AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher. It's 8:48. We have a guest in studio today from Central District Health Department. My pal Teresa Anderson's here to bring us up today. Welcome back.
Well, thank you, Brian. It's good to be back.
We get to talk about shots, and we've gotten really good at this over the last few years with the pandemic, but this is important because there is a new version of, is it trivalent?
This is actually a monovalent.
Monovalent. Okay.
Yeah.
There's all the terms for the vaccinations that are available to help in the battle against COVID. I'll let you take it from there.
Okay, thank you, Brian. We have a new vaccine that was just approved yesterday by CDC for administration to everyone 6 months and older. This is a newly developed vaccine that's coming to us in two different ways. One of them is from the CDC, where we actually won't have to charge for it, and that's good news. The other one is that we'll also be buying some private pay vaccine, and that we have to pay for at the health department, so we need to pass that along to the folks that are getting their shots through insurance. So if your insurance covers those shots, which we are being told that most insurance will cover the cost of the shot and the administration fee. If your insurance doesn't cover, or if you don't have insurance, we have another program called Bridge, which allows us some, I'm going to say free, that free word, that vaccine that we can make sure that people get covered, because we know how important it is to, as you said, continue this battle and win it in this COVID continuation.
When we've discussed this before, I don't think anybody thought there was any possibility that 3 years later we would still be talking about this.
You know, this virus is very resilient, and it keeps changing its structure a little bit. What we're being told is that this monovalent COVID shot that we have, or will have next week, is very effective against it. Now, is it 100%? Will it keep you from getting COVID? Not necessarily, but in most cases, it will keep you from having severe symptoms and staying out of the hospital. What we're seeing right now is an increased number of cases throughout the country and also in our area.
I have heard over the last few months folks that have had cases and have had seemingly even more advanced side effects, or just when they deal with the actual condition, it's harsher.
Yeah, what we're worried about with, and continues to be a concern of ours, is what we call the long COVID. So people who actually get COVID and have fairly serious, a serious reaction or symptoms with COVID tend to be those that develop long COVID, and those symptoms can be anything from kind of a brain fog to a weakness to heart conditions. I mean, there are all kinds of things. We don't know enough about this virus to understand it completely, but we do know that we want to avoid getting that virus if at all possible.
Teresa Anderson's here from Central District Health Department. I've been fortunate. We've worked together. I've had a chance to go through the entire series of shots so far, and it's worked. So I'm here to say yes, they are effective, and I highly recommend that you go. Are the shots available today?
We do not have vaccine today, because once it's approved, then we have to order it and wait for it to be delivered from the companies that manufacture it. Also, that vaccine that I talked about that's coming to us from the government has not been shipped, but what I understand is that we should have it at least by the middle of next week.
So do you suggest appointments, or is it something once it's available, people can stop in?
Boy, I don't know. I don't think we've thought that far ahead, Brian, but we're going to.
In general terms,
then.
then.
What we do is we never miss an opportunity to vaccinate. So what we're going to do is, if someone right now hasn't had their COVID shot or booster for the last 6 months or so, one of the recommendations is we have vaccine here today. So if they're thinking they're going to be in a high-risk situation around other individuals, or they're going to be around someone who has underlying health conditions, heart disease, asthma, those kinds of things, we say, today we're going to go ahead, this is what we say today, we would like you to get a COVID shot now, even though it's not the newer version, because what we know about the current vaccine is it is effective against these Omicron variants, which are 90% of the viruses that we're seeing.
This is not intended to be a pun, but it truly can be a shot in the arm for prevention. There is no cure for this, at least today. Now, could there be one someday? Yes, but think of the common cold, think of flu. Unfortunately, these are conditions that we deal with, and COVID seems to have a shelf life that has no expiration date
It
right
does.
now.
And, every year they match up the flu vaccine with the circulating viruses to make sure that we're the most effective in preventing flu. I think we need to look at COVID in a similar fashion, that we may be looking at an annual shot. And we know this is the good news. You can get a flu shot in one arm and a COVID shot in the other arm at the very same time with no potential reactions.
That's good news.
Yeah.
If folks have questions, how can they find out more?
They need to call us, and we can connect you with one of our nurses. Call Central District Health Department, 308-385-5175.
Teresa Anderson with the latest. Shots should be available next week, but check first.
Should, yeah.
Okay.
That's
All right.
the operative word.
Teresa,
Thanks,
always a
Brian.
pleasure. Thanks. Good morning from AM 1430, KRGI 105.5 FM.